Good morning, Nisam Bulavinaka, Salam Alaikum, Namaste. I am indeed pleased to be invited to speak at this important forum. At first, I was somewhat surprised when I heard the title, Law and NCD, and wondered whether this was something new. Then my memory went back to April when I was invited to speak at the Western Pacific Implementation Workshop for the Framework Convention on Tobacco Control, co-hosted by the Ministry of Health and the World Health Organization. It again became clear that one of the best ways to prevent and control NCDs is to put into place legislative or policy framework that would not only best serve our development purposes, but also safeguard or protect our health and that of our children. I definitely agree that legislation is one of the best ways to address public health issues. And HIV and AIDS and tobacco control have shown us the example. A lot of progress has been made since the enactment of the HIV and AIDS and the tobacco control decrees in Fiji. The access to treatment and the confidentiality of people living with HIV has progressed well. I am told that the rate of smoking in Fiji is now decreasing as a result of the enforcement of the tobacco decree and the increase of the tobacco tax. I believe these physical and legislative measures are effective in ensuring behavior change at individual level as well as changes at organizational level. I would challenge you to take heed of what we have learned from the HIV and AIDS and tobacco control and transfer these to NCD action as well. Let us put into place policies and legislative measures that will apply ample protection and the greatest source that we have. Rather, the greatest resource that we have. That is our people. Our people and their health. Without a healthy and productive population, our economic vision and our aspirations cannot be fully realized. I would like to speak particularly about children, our future. The environment we create for them today determines in a way their lifestyle and their health in the future. Although NCD is a lifestyle disease and left to the individual to make their own choices, the children do not have such privileges and are quite vulnerable and need to be protected. This is where the law and policy comes into effect at population level to support action at individual and family level. We should not be bringing up our children in an environment that exposes them to the risk factors of tobacco and drug use, unhealthy diet, and physical inactivity. These so-called obesogenic environment lends people, especially children, to indulge in behaviors that puts them at risk of having NCDs. Whilst it is desirable to promote healthy lifestyles for individuals to adopt, we must also ensure that we are protecting those members of our vulnerable populations who cannot and are not able to make well-informed decisions and choices. Much of their behavior is determined by the environment in which they live. For them, health promotion alone is not sufficient. We must also put in place health protection measures. We already have smoke-free cities and schools, but I strongly recommend that we have smoke-free homes, legislated for as well. How can we blame a child who smokes later on in life when he or she has been brought up in a home environment that has dad or mom or uncle or aunt or other relatives smoking without any concern whatsoever for those around them? You've seen it happen, I've seen it happen, and it does happen. But we legislate for it in the clubs. Why not in the homes, where the children spend more time? Also, for this reason, we must not only protect children from all harms of life like tobacco and unhealthy foods, but also from the power of marketing that can have a lasting impact on the immature mind. The power of marketing of unhealthy products on our children is immense. And if we are not careful and caring, we may lose generations to unhealthy lifestyles and NCD if we have not started doing so already. I believe there is a bill being prepared to restrict or ban the marketing of junk foods to children, and I would encourage that this be pursued with much vigor by all concerned. This is a worthy cause. Let us free our children from the temptations that will lead them to these unhealthy behaviors. Most of our religious teachings say that, quote, teach the child in the way they should go, and when they grow up, they shall never part from it, unquote. Let us teach them the right way from the beginning. No tobacco or drugs, eat healthy and be physically active, and provide the right environment for that learning to be enhanced at home, in schools, in the villages, and in the cities through legislation. As you are all aware, the leaders of the Pacific, including Fiji, have declared NCD a health and economic crisis and have committed to battle it accordingly because the Pacific holds some of the highest rates of tobacco use, obesity, diabetes, and cardiovascular disease, and the record of the early deaths from all of them. This is contributing to the poverty and to much social and human misery, and proving very costly to family life. NCD is the leading cause of deaths in Fiji. Most of these deaths are occurring before the age of 60 years, something we call premature death, as they are occurring in what is generally considered a productive portion of the population. NCD is a national economic development problem, as much as it is a health problem. It is serious, so let us get serious about it and use legislation to its full potential to aid in the fight against NCD, not only for this generation, but also for the generations to come. I call on all government sectors, as well as the whole of society, to scale up action on NCD. I am glad that one of the renowned professional groups is leading this charge, none other than the Fiji Medical Association. And I am further informed that they are working closely with lawyers from the Fiji Law Society. Also, we have other civil society groups like the Diabetes Fiji, the Consumer Council, the faith-based organizations, as well as the regional and international partners like World Health Organization and UNDP, assisting the Ministry of Health in this endeavor. I see a great gleam of hope with these three parties: government, development partners, and civil society groups coming together at the table to discuss these measures. And I am very optimistic that what the government has targeted for NCD will be achieved in the not-too-distant future. So let us create a healthy, NCD-free Fiji. It can be done, and legislation has a huge role to play in its achievement. Ladies and gentlemen, I thank you for your attention. Vinaka Vakalevu, Shukriya, Bahut, Dynavad.